having seen the most heartbreaking pictures this week of nurses at the Tembisa Hospital saying goodbye to their colleague, Lebo Monine, dancing and singing and going with the forensic van as she was removed after her police officer boyfriend arrived at the hospital and shot her dead. He's now in that same hospital after he tried to kill himself. But this really shines the spotlight on the mental health of our police officers. You know how difficult it is, how difficult our society is, how difficult it must be to be a police officer. Mpho Kwinika is the General Secretary of the Policing Union, Mpho. He joins us now. Mpho, good afternoon to you, and I really do appreciate you coming in. This was clearly a young man under the most incredible pressure in many ways. I mean, he must take responsibility for his own actions. Yeah. But he must have been living under horrible pressure. What kind of pressure do our police officers live under?
Policing is a very difficult work. I've said this previously, that it's one of the most unthinkable work that they are doing. But police officials need support. Police need support from family pressure. They need support from the policing pressure that they come across at work. This is a profession which has got a department which we refer to as Employee Health and Wellness Program. That's where you find the health professions. The people that are employed in that environment are coming from social work, the environment, psychologists, and you've got the chaplain services as well. So the department policing has got the resources which police officials need to deal with their mental problems.
Are those resources available? I mean, can a police officer knock on someone's door, or phone someone, or WhatsApp someone on a phone line and say, look, I've seen this today, or I had to deal with this last week?
Yes, these services are there, but these services are not trusted. They are not trusted because of there are a variety of issues that attribute to this. One of these things is to link the Employee Health and Wellness Program to rank system. If the police officer has come across a problem with a senior police official, and if you then send one of the health professions to go and assist him or her, the moment they get into that space and they look at the uniform and the rank, they associate these people with those police officials. The other thing that we have in that environment is that the very same health professionals, they will compile a list, a problem that problems which members come across, and make recommendations to the senior management to take actions against, to rectify the problems the police officers are coming across. And you find that management are not willing to do that. So these issues, when they come across these police officials and are unable to get that assistance, then they go hayway.
So, I mean, there are many different things. I mean, we've known for many years, and in fact, police officers come from different parts of our society. Yeah. And in fact, I'm aware of stories from officers from all different parts of our society, all men, who've sort of snapped, and again, they must take responsibility for their own actions, but it's often their own families. So there have been cases where they've shot their own children, and then their wives, and then themselves. There have been cases where they've shot their own partner, as in this case. What that tells us, the only thing these people have in common is that they're police officers and that they have access to a gun.
Yeah, look, the firearm is a tool of trade. It's a tool that they utilize to service South Africans. You know very well, Steve, that South Africa is a very violent country. You need to have this kind of a tool, but we should not shy away from the management responsibility to make sure that police officials are looked after. Their mental health is very important. They leave home with the intention to go and service South Africa. It's not to go and plan any kind of an attack on anyone. So we must utilize these resources to make sure that the mental situations of our police officials is taken care of.
You spoke about the mental health services, you spoke about some of the problems, but, I mean, for example, the chaplain service. Are the chaplains properly respected? If the services and the people who provide those services aren't respected by the top brass, no one's going to go to them.
It is true, and then I can tell you what happened in the West Rand. One of the most senior police officials in there had ill-treated the head of the chaplain services in front of his own juniors. We are in a command and control environment here. If that senior police officer is treated like that in front of his peers, there's no way that he will lead those people again. So we as unions are now struggling to make sure that the police officials, those members whom he leads, they understand the situation under which they serve. Now we want to make sure that when we leave here, because this is what we are busy doing, there are meetings somewhere today trying to get a solution to these issues. I will be joining them when I leave here to make sure that they understand that the situation they find themselves in is unbearable, and we know that, but we need to continue and soldier on. Because if they are not okay in their minds, do not expect them to go and fix another person's mind. We have to fix their minds first so that they can be able to fix our police officers' minds.
I mean, you're talking about a police officer who might come across someone who's on a bridge wanting to commit suicide. Now, you're asking that police officer to help someone, to talk them literally down off the bridge. How are they able to do that if they aren't able to look after themselves?
Yeah, you see, that is why we are saying the support system in the police. Senior managers need to lead by example. The police is in tatters. I think the president has said it yesterday. We need to fix this. And I think he even said that the community structures need to come in through community policing forums to try and come in and assist the police that is already in distress. But if the senior police officers within this environment, they are unable to see what the president of the country can see, then they are in a wrong place.
There's another thing to it. So there's support, and there's the support ostensibly, definitively and meant to help mental health. There's also the way that police officers are treated in terms of shift patterns, in terms of how they're paid, in terms of whether they're promoted or not, in terms of whether they're able to work at a police station they want to work in, or if they're able to move if they need to. I know police officers are moved quite regularly. All of those things have come under simple management. And so what that normally means is, even if you're not a police officer, even if you have a nice, easy, cushy job like, I don't know, being a TV anchor, if you don't have a nice boss, you're going to find that very stressful. Yes. I'm lucky I don't have that problem. But if you're a police officer and you've got a horrible boss, you don't get on with your station commander or whatever, that must make it so much worse. So how big a factor is that?
No, you see, that's why even when we receive this complaint from Western, we have then put everything at our disposal to make sure that we address that issue, because it does have a terrible impact on them. Look, you have got 5 management functions: decision-making process, planning, organizing, delegations, and there's another one that I've forgotten about. If you have a commander, you have a manager who does not have this, because these are just the elements of good proactive policy. Then if you don't have this, you immediately shift into reactive policy. This is where you see police officers who are supposed to be working and get paid. They are not being paid because there wasn't a planning. This thing was not organized. You don't have a financial authority to make sure that those people, when they are done, they are being paid. If you pay them, it happens that you pay them. You pay them after 3, 4, 5 months. The system is untenable. Sure. So these are the problems which we need to deal with as management first, and make sure that police is grounded as a two-legged animal, both proactive policing and reactive policing. These 2 legs need to stand on their own, and the institution will be able to be balanced. Otherwise, we've got a problem.
There's a huge amount of discussion around policing at the moment, and I'm sure you're going to have another go at what the President said last night, no matter what I ask you, which is fine. But we have on the one side the management of the police, and I'm talking about the top management, the National Police Commissioner, the President promising changes in leadership, although he didn't mention the National Police Commissioner by name. At the same time, we have what happened at Tembisa Hospital in this terrible story. Are you optimistic that all of the attention we're giving the police is actually going to lead to any change? Or are you worried that we're just going to continue with the failure that we have now?
Look, the President has made a decision that security cluster need to be looked at. And the police is one of that department. He had already moved SSA. It's in his office now. Something that we're not happy about, because it should not be forever. I think he is doing it temporarily because he need to deal with that situation. But policing as being part of this, this is an executive department of state. Remember, we said this last time. This department need people who have got capacity and passion to understand exactly, have the ear and eyes to hear the heartbeat of what is happening on the boots, to the ground, on the floor. If we don't have leaders who have got that passion, the leaders who, like currently, you'll see that they are fighting for survival. They are always looking above their shoulders for their survival. And when they are busy doing that, they neglect the most important task, which is to look after those boots to the ground, who are very important in ensuring safety and security to all inhabitants of this country.
It must be very frustrating. I mean, there are a lot of critics of the leadership of the police. I still can't understand why the President hasn't removed the National Police Commission. I realise the National Police Commission will have some supporters, but there's 2 criminal charges, there's court cases, there's the whole bit. I still don't get it.
Look, if the President takes long to fix policing today, I think there are a lot of activities this year. We're going to see, I think, Women's League conference is coming, the Youth League is coming. The national, what do you call the conference of the ANC is also coming. These are big events. You will remember in 2017, the Grabber issues. It came in right into that space. I don't want to see, we don't want to see an environment, like the one which we saw in 2017, where the current National Commissioner of Police was involved in. So I saw a spokesperson had left with immediate effect, I think effective from the 1st of February. Yes. That tells you that something is going to happen very soon in that environment. And the sooner that happens, the better for South Africans and the better for all people to can live in a country so beautiful like South Africa.
Mpho Kwinika clearly got the political ear to the ground. Thanks very much indeed, General Secretary of the Independent Policing Union, Mpho.